Week for our own wellness is going to encourage more of us to do healthy things. Please help me welcome Kevin Overby. He is the director of Clear Advantage Trust, which is consumer-directed health care with a robust wellness program trying to reduce the cost of health care and increase productivity in the workplace. The company he initially founded, ClearPoint, was an employee benefits consulting brokerage and was selected as one of the top employers in Washington State for 7 years. Last year, ClearPoint joined Alliant Insurance, where Mr. Overby is the managing director and executive vice president. So now he's going to tell us about the secret to wellness. Please help me welcome him.
Hello, everybody, and shh, don't tell anybody, it's a secret. But first of all, being that we've had the opportunity to work with hundreds of employers, and I've had the opportunity to also survey healthcare systems around the world by the work that I do, one thing that became pretty clear, and what we heard from a lot of people, is how do you align the incentives? What's in it for me? And so how do you get in front of, there's some great people who do great work here, but how do you not need to use them? Essentially, and what can you do, and how can you be aware of what kinds of things you can do to drive better health? And then how can you make that alignment through the employer healthcare system as we have it today? Because the employer, the employee, and also the insurance community all have a vested interest in making people healthier and reducing risk. So this is the first slide. This is somebody who's our employees are our greatest asset. I say we sell them. And so one of the things that does get thrown around a lot, and I think that everybody does believe that their people are the engine of their companies, no matter what they manufacture or the like, but how are they investing in their people? They do it in the workplace through work safety. They also do it through performance measurement and management. And one of the things that we'll talk about is that what you measure on a frequent basis, you have a better chance of managing it. And how do you, in this process, direct all of this down to the employee level? Because everybody feels they pay a high insurance rate. And what the rate is essentially all of the behaviors of all of your people added together, divided by the population, that's your rate. So unless you affect each individual in the population and get people to meet you, or we meet them where they are, whether they haven't contemplated any health change or whether they've been really thinking about it but they can't kind of tip and get it into a habit, how do we meet them in order to reduce their risk and risk factors? Because 10% of the population, through our research, drives about 70 to 80% of the cost. 10%. That's when healthcare goes really wrong. But on this next slide, these are some of the conditions that drive that. And this is the percentage, according to the American Heart Association, National Cancer Institute, etc. This is the percentage of cancer, stroke, coronary disease, and diabetes that can be avoided through behavior change. That your behavior leads you to these situations often. Sure, genetics play a role, your environment play a role. But the first thing we want to help employees understand is that they've got a steering wheel. I use the car analogy a lot. That the employee has the steering wheel in driving their health outcome through their behavior. And how can we help them understand what behaviors are getting in their way? And then creating a culture at the employer that also reinforces that behavior. Because the employer is a huge peer group that does help influence how employees behave, whether at the workplace or other things that they may do in their free time. And also, when we go to the employees, and we show this in enrollment meetings, nobody wants these for themselves or their families, but how can we give you mile markers in the road to help you understand if you're trending towards or accumulating risk factors that may lead to these diseases? So this next slide is the obesity epidemic in America. It starts in 1985, and you'll see that the darker the blue, which turns to yellow and red, this is the epidemic of people that are considered obese by the Center of Disease Control. And so what's happening is that as society grows, there's more pressure in society, more accountability to do more. People aren't moving as much. You're sitting at a computer, you're stressed out, you've got 15 emails right now in this meeting that you're going to have to respond to. What happens is that all of a sudden, I like the barbecue bill, which is kind of Texas to Georgia. But the reality is, again, and I'm not going to, a little bit of bashing of the food companies is that people are ingesting more calories than they can burn. And the food industry is building product that makes you want more and want it faster because it makes you hungry again. So until employees understand this little trade-off between caloric intake and expenditure, you're going to see this kind of trend continue on. And this is the Western lifestyle. And don't worry, we're exporting it to China now. Their rates of cancer and heart attacks are going up too. But the idea here is that we have to educate people to get in front of this thing. And how do you do it? And how do you align incentives to do this? So again, determinants of health. Behavior drives the majority of it. This again, Center of Disease Control data. Environment's a part of it. Genetics are a part of it. Access to care is a part of it. But what do I do? What do I eat? Do I move? What is my belief system on how much control I have over my health? So what we've done in our program is to align kind of a new paradigm, which is what's in it for me? What's in it for the employee? Well, it's my health and it's my money. So there's going to be economic incentive and also other incentives. We really try to help people focus on, do you want to feel better? Live longer? For me, it was I needed to change some habits or I wasn't going to be around likely to walk my daughter down the aisle, when she got married. That was my visual. That's what I hung to. And that was the leverage point that made me change some things. So now I'm just a heavy drinker. But anyway, if you align engagement, then the first goal is lower the demand for healthcare. We're all sitting here figuring out who's going to pay and how it's going to pay, how it's going to be paid. What if people just didn't need it as much? With a huge emphasis on prevention. That's a real key as well. Know your numbers. And Primera has had a great campaign with this. And they're one of the partners in this program that I'll show you the results of. But knowing your numbers is critical. Where am I? And then how do I continue to know my numbers through time? Which is cholesterol, and blood, etc. So in the world of aligning incentives, for the employee, what our programs are designed to do is to lower the cost for the employee, lower the cost for participation. If I engage in healthier behaviors, my premiums drop. I pay less to get this insurance because every employee and every employer thinks they pay too much for health care. Second, I get an incentive, which we've used consumer-directed plans to help people make choices. And I heard the comment today, it's not that you're going to get 3 valves versus 4 valves, it's which facility delivers the lowest level of complications and the highest quality of health care. And that's debatable. Again, there's no evidence-based medicine, I think, is a slippery slope as well. The person in charge is that if you're working with your physician and it doesn't seem right, get a second opinion. Use a panel. Go out and find more consultative care. The other is learning about life behaviors that drive poor health. The employer is incented because they're going to lower the cost for health care. What we've done in the programs is the insurance company, if you get participation in the program, will lower your cost of insurance today. Not delayed gratification, put in wellness and we'll see how it goes. If you get a certain percentage of people into the program, your costs go down up front, which helps fund some of the programs. And also, the employer gets to provide a culture of health, which not only lowers healthcare costs, but also improves productivity. It's been widely reported that for every dollar you save in healthcare, you pick up another $2 in productivity in those work environments. An insurance company, lower risk equals lower premium requirement, which means they're more competitive on the street. So those are the incentives.